Have you ever woken up at 3:17 in the morning, heart racing, mind spiraling, already exhausted for a day that hasn't even started yet? No alarm, no noise, just your body wide awake, carrying the weight of yesterday and the fear of tomorrow. If that's you, you're not broken, you're not alone, and you are not imagining it. Educators everywhere are waking up between 2 and 4 a.m., and it's not because of caffeine or bad sleeping habits. It's because teaching in today's world is placing demands on our nervous system that our bodies are struggling to carry in silence. Today, we're pulling back the curtains on what I am calling the great 3 a.m. teacher wake up. What's happening in your brain, your body, your breathing, and what this moment is trying to tell you about your stress, your emotions, and your health. I am joined by sleep expert Emma Cooksey, who is helping us decode why so many teachers are awake in the darkest hour of the night and how we finally get our rest back. The conversation might just change the way you think about sleep and yourself. This is Everything But the Lesson Plan, Season 10.
Welcome to the show, Emma. How are you?
I'm great. Thank you so much for having me.
Yes, I'm so glad I found you. I think I was sharing with you earlier. I found you on Instagram. You do a really good job with your Instagram presence and getting the word out on sleep and sleep apnea. So thank you for that.
Of course, it's my pleasure. I'm so happy to be here.
Yes. So you know what? I want to just start with the obvious question, okay? Because I just did it today, well, last night and the night before, and all of those, every single night I am waking up between that 2 a.m. and 4 a.m. Why are so many teachers waking up between that time?
So, first of all, I've got to just say I have two children, and teachers are just the most wonderful people in my life because
Yes.
like I really appreciate what you all do.
Mm-hmm.
So I just had to get that out of the way. But
Oh,
so a
thank
lot of
you.
people ask this question, right? Like, why am
Yeah.
I waking up, between 2 and 4 every night? And if you look on social media, you'll see a million different take the supplement, use this pillow,
Mm-hmm.
all these different things that you can try to help with your sleep. But for me, what the really big question is should you seek professional help for your sleep, right?
Yeah.
So there's a
Right.
difference between people who maybe just aren't getting enough sleep or
Mhm.
just need to focus on what we call sleep hygiene. So
Yeah.
things like making sure that your room that you're sleeping in is dark, cool, and quiet. Making sure a really big one is getting enough light in the morning. So that's something that a lot of
Mm.
people don't realize. Like that helps to reset your circadian rhythm. So
Oh.
that's a really good thing. But once you try all these things, right? I think most people know, like, they should be getting between 7 and 9 hours sleep a night, and it varies between people. But generally, a lot of us are getting a lot less than that.
Mm-hmm.
But once you've kind of really focused on trying to get enough sleep and, focusing on the quality of your sleep and all the things, and that's not working, right? And you're still waking up, um, that's when I think people need to start thinking about like why they're waking up and whether there's
Yeah.
some professional they could see. So the
Mm-hmm.
question really is what's happening when someone wakes up. So it's very normal to go through different sleep cycles, right? You have
Mm-hmm.
different stages of sleep. It's normal to have brief awakenings like all through the night. Like it's very normal. Often we don't
Mm-hmm.
remember them. But
Yeah.
I think what you're talking about is waking up and then not being able to fall back asleep because
Mhm.
you're thinking about all those things. Like with teachers, I'm thinking lesson plans and like,
Yes.
issues with coworkers and issues with students, all the things. So
Yeah.
if that's the case and you're having a difficult time like falling asleep in the beginning or staying asleep,
Mm-hmm.
then you have to start asking the question, could it be chronic insomnia? So
Mm.
we often talk about having insomnia just because we're having a tough time sleeping every so often. But chronic insomnia is difficulty staying, like falling asleep and staying asleep, um, multiple times a week for months, right? So if it's kind of a common problem every single night, the best treatment for chronic insomnia is a thing called CBTI or cognitive behavior therapy for insomnia. And most
Mm-hmm.
people don't realize that it's actually got more evidence to support it than sleeping pills. So
Mm-hmm.
oftentimes people would go to the doctor and get some sort of sleep aid, and that's not really a long-term solution. Whereas
No.
cognitive behavior therapy for insomnia teaches you the skills you need and different strategies to use. And it really varies between people. So it's difficult. Like we can't really just say, here's the 10 things, you should do that are CBTI
Yeah.
things because it just depends on the person.
Person.
But now it's becoming more accessible because they have certain evidence-based apps, like the Sleep Reset is something that's covered by insurance, and it does have evidence to support it. I would say the best thing you can do is find a board certified sleep specialist. So with behavioral sleep medicine, that's usually going to be a clinical psychologist. There just aren't enough of those experts out there.
Yeah.
So another thing I recommend to people is there's a book by one of my friends, Dr. Shelby Harris,
Mm-hmm.
and she wrote The Woman's Guide to Insomnia. And that book is filled with really helpful advice and tips. And Dr. Harris is also on Instagram, so she's a really good resource. So that's kind of like the insomnia part of it. Um, but I think one of the things so I'm a patient advocate and I work at Project Sleep, which is a nonprofit where we're helping people with our priorities are sleep health, sleep equity, and sleep disorders. And what we come across a lot is that people don't realize sleep disorders are actually not really that rare. I think oftentimes
Mm.
people think, well, I couldn't have a sleep disorder. I'm just having a tough time sleeping because I'm stressed.
Yeah.
But when you dig in, obviously my favorite subject is sleep apnea. So when
Mm-hmm.
you dig in, if somebody is waking up gasping,
Yeah.
so you're waking up anxious and gasping for air, that can sometimes be a sign of sleep apnea. So that's,
Wow.
yeah. So that's kind of, sometimes people don't realize that sleep apnea can be the thing causing the waking.
Mm-hmm.
And it's
Yeah.
also possible to have sleep apnea and insomnia at the same
Same
time.
time. Wow.
So that could mean the sleep apnea is waking you up and then you're staying awake because of the insomnia. So again, with sleep apnea, you really need to take a test to know if you have that.
Yeah. So
So
wait, let me tell, so we're gonna get into the sleep apnea because
yeah,
I'm very curious.
that was
Tell
a
me a
lot of
little bit of,
information.
no, it was great information. Especially with the things that we could do. The dark room, the coolness, the quietness. I'm like, maybe I'm not setting up really good sleep habits myself because I feel like I do have a problem. And you know what? Like you said, it might be a disorder that I really need to go get checked out. A lot of people always say, especially with teachers, oh, it's just stress or it's just because we got a lot of things to do, but it could be something else. So I'm glad that you pointed that out. But I
Yeah.
would love to know a little bit more about your journey with sleep. How did you get into this field with sleep apnea? What sparked this?
Yeah, it's quite an odd job, right? Being a patient advocate. So,
Yeah.
I had all of the symptoms of obstructive sleep apnea. So there's two types of sleep apnea. There's obstructive sleep apnea where your upper airway gets repeatedly blocked during sleep and cuts
Mhm.
off the oxygen to your brain, wakes you up multiple times. And then there's also central sleep apnea where your brain is not sending the message to breathe. So I had all of the symptoms of obstructive sleep apnea, which were loud snoring, waking up gasping. I had a morning headache every morning. I had mental health issues with anxiety and depression. I just was really struggling for about 10 years. And I went to doctors
Mm.
over and over again saying I am struggling. Like daytime sleepiness was one of the worst things. I could hardly stay awake at work. And the doctors would just say, yeah, we don't know. They wouldn't really ask me about my sleep. They just would send me away. And for women especially, there's this whole you're stressed. And then for me, it was you're pregnant, you've got a new child.
Yeah.
And I knew there was something wrong with my sleep, but nobody would take me seriously because they weren't
Mhm.
used to seeing sleep apnea in women, right?
Yeah.
So I actually fell asleep at the wheel.
Oh.
And my baby in the car with me. And we'd been out running errands in the morning, and I was driving home. So I live near Jacksonville, Florida, and we were
Yeah.
driving home across the Buckman Bridge, which is
Oh
this
my
huge
gosh.
bridge with like 5 lanes of traffic each side,
Yeah.
nowhere to stop, nowhere to pull over. And I just had that feeling like that drowsy, couldn't keep my eyes open, really tough time staying awake. And then the next moment, I managed to avoid colliding with a big truck, but
Oh.
it was like it felt so like I just went home with all the adrenaline rushing through me, and I just felt like I could have died, you know?
Yeah.
So that was really the turning point for me. And I called my doctor who hadn't really been taking me that seriously. And I said to them, I'd never heard of sleep apnea or sleep disorders, but I said I need to go and see somebody about my sleep because I fell asleep at the wheel and this is really serious.
Yeah.
So that's how I had my sleep study. So they do a test for sleep apnea, and they told me I had sleep apnea, and I was literally like, "What is that?"
Yeah,
I'd
I
never
bet.
heard of it. So I would say like so getting into this kind of work, like I
Hmm.
just kind of struggled, and I was the only person in my life I knew with a sleep disorder. Like I'd never really, the only people I ever met that had sleep apnea were people's like grandparents or much older
Hmm.
people that had other health problems.
Yeah.
But I never really met any other moms like in their 30s, you know?
Yeah.
So that was kind of what led me eventually
To
during the
get into this.
pandemic to start my podcast. So I started a
Yeah.
podcast called Sleep Apnea Stories in the summer of 2020. And God bless teachers because when my kids were home and I was having to do remote, helping them do remote learning, it
Hmm.
was really tough and I needed a project, really. So
Yeah.
that was where my podcast came in. And I interviewed a lot of different people, especially women and people from all different backgrounds,
Yeah.
on their journeys with sleep apnea and how they were treating it and the experts who treated them. So that was kind of how I did that. And then I met Julie Flygar, who's a woman living with narcolepsy, who
Mm.
started a nonprofit called Project Sleep. And originally, I volunteered for them on their board for a number of years. And then now I work for them as their sleep apnea program manager. And yeah, I
And
create
this is your calling.
education. This is my calling. It really
Yeah,
is
it's
my
your
calling.
passion. Yeah, it's your
Yeah.
and I can see,
Yeah.
like I said, your social media tells it all. I'm gonna have to listen to a couple of your episodes on your podcast as well, because
Well,
this
there's
is a
104E, so
oh
you have your
yes.
work cut out. But
Okay,
yeah,
well that's
I
good.
think that those are still really helping people because I think
Yeah.
sometimes like people like to see, someone they can relate to that has a similar
Hmm.
story to them. So yeah,
Yeah. Yeah, because when you were telling me about you falling asleep, I remember when I worked for Atlanta Public Schools, and I think I just was not getting enough sleep. And then I spent too much time in my car.
yeah,
Um, it was an hour and a half getting there and an hour and a half coming home. And it was the coming home part that I was literally on the highway. Thank God it was rush hour traffic every day. But I was falling asleep. I was taking little
yeah,
naps whenever we were at a complete stop. And I was like,
yeah.
oh my gosh, I can't keep doing this.
But this is the thing. Like I think whenever I'm sharing my story, like the thing that's shocking is
Mm-hmm.
how many people are
Mm-hmm.
saying, "Oh yeah, I fall asleep at the wheel," or
Yes.
I've done that, and
Yep.
that's a problem, right? Like
Yeah,
I
it's a
think
problem.
sometimes it is not getting enough sleep, and especially like one of the reasons we focus on sleep, like we focus on equity issues, is that I think oftentimes, people will say, especially on social media, you'll see a lot of people say, you just need to get more sleep and have this, nice sleep environment and all the things. But we're not talking enough about people who don't have control over those things, right? People who are
Mm-hmm.
working three jobs. And I know teachers who are working multiple jobs or have side
Yeah.
hustles and so if you physically in your day don't have the time to get the right
Mm-hmm.
amount of sleep, that's an issue. That's part of what
Yeah.
we need to be discussing, right? Because it's
Yeah.
not good enough just to tell people get more sleep.
Yeah. Yeah. And I got to move some things around personally, and I know some other teachers as well to make sure that I'm getting enough sleep. Sometimes, you know how it is with these phones. We get in that bed and we have these
Hmm.
phones, and I know that is a horrible habit. A matter of fact, I've seen studies that say don't even have the phone in the room with
Yeah.
you,
And
because
and here's the thing,
Mhm.
everybody struggles with that. I struggle
Yeah,
with that. Like I feel like I often say to people, do as I say, not as I do, because
yeah,
sometimes I struggle with that. One of the best things for that I find is following, there's a Duke University professor who posts all about sleep called That Sleep Doc.
hmm
And he has videos where it tells you to go to sleep.
Oh,
And honestly, like the number of times his videos have popped up in my feed, and I've just been like, I should go to sleep.
oh,
So, and
okay.
they're kind of fun and entertaining too. So that's always
Okay,
good
I have to check that out. So let's go back to this to sleep apnea. I just
to.
want you in the simplest terms to define what that is.
Okay. So, like I was kind of mentioning before, there's two main types.
Mm-hmm.
So you can have a combination, but the most common is obstructive sleep apnea. So
Mm-hmm.
that's usually what we're talking about when we talk about sleep apnea. So obstructive sleep apnea is where your upper airway, so we're talking about, your throat basically becomes either obstructed by soft tissue, so it could be your tongue falling back in your airway and blocking your
Hmm.
airway off, or it could be your upper airway collapsing in on itself. But either way, you're not getting the oxygen you need to your brain because your upper airway is compromised.
Why is
So,
it doing that? Why would it
well,
do that?
yeah, a number of different reasons. So there's one of the things that makes sleep apnea so difficult is there are so many factors that can be at play, right? So for some people, they're just the structure of their throat and their the way that their jaws develop mean that they have a really small airway.
Hmm.
And so if you have a really small airway, it's just really easy for that to collapse in on itself. It can
Hmm.
also be one of the big risk factors is the size of your body. Like they talk about like, people having thicker necks. And that's not the only reason. Lots of young, thin women have sleep apnea. But this is one of the things that they see happening is the more weight you have around your neck, that can put pressure on your airway and cause it to close.
Okay.
And then it's all linked in with like, is your nose working properly? And like, that's not gonna by itself cause you to have sleep apnea, but like certainly that's made mine more difficult to treat because I can't breathe well through my nose. So the other thing is actual obstruction, like if somebody has really large tonsils that have never been removed, that can cause the obstruction in their throat.
Hmm.
So there's a lot of different things at play, but the main thing is probably like what I focus on the most with my Instagram account and my work at Project Sleep is recognizing what the symptoms are, because that's really how people will get the, testing and diagnosis and treatment that they need. So I don't know if you want me to like kind of go through some of the symptoms.
So let me ask you this then. This causes is this something that will cause you to wake up early?
So it essentially causes you to wake up multiple times all through the
Times
night,
through the
basically.
night.
And you may remember them all, or you might not remember at all. It could just kick you
Mhm.
from deep sleep into light sleep. And that's a
Yeah.
problem too, because your body really needs that restorative deep sleep. So yeah, that's what makes it so difficult to spot, I think, for so many
Yeah.
people. And especially for women. I mean, I know not all teachers are women, but like as a profession, like it's
Yeah.
predominantly women that are
Women.
are doing a lot of those jobs. And I think oftentimes when people, even if they know a little bit about sleep apnea, they think about loud snoring, which can definitely be a symptom. But for women, you have this combination of you may not snore, or you might snore very quietly,
Mm-hmm.
or you might just have a husband like my husband who is sleeping soundly and isn't interrupted by the snoring and so never tells you. So unless you're
Yeah.
sleeping with like there's an app like Snore Lab that you can record your sleeping to see if you're snoring. But for
Mm-hmm.
a lot of people like people who are single or people whose bed partners are not very observant, like it's easy to miss some of those signs.
Yeah. And you know what? I'm thinking, so if I have sleep apnea or if I'm struggling with stress at night and it's all contributing to this 3 a.m. wake up, what are some of the signs that I will see when I'm up, during the
Yeah.
day?
During the day, yeah.
Hmm.
So one of the biggest things you're going to see is daytime sleepiness. Or I
Hmm.
think sometimes the wording is important because people will talk about fatigue or
Hmm.
exhaustion or sleepiness as though they're all the same thing. And the problem that I found with going undiagnosed for so long was when I went to the doctor and said, I'm so exhausted. Like
Yeah.
they didn't think, oh, there could be a sleep problem, right? Whereas if
Yeah.
you say I'm having excessive daytime sleepiness, so that
Hmm.
means, in real terms, that means you need coffee to function. You
Hmm.
are, getting after lunch, you're struggling to keep your eyes open because you're so sleepy. So
Yeah.
that is definitely a really big daytime thing. The other thing that shows up a lot with sleep apnea is morning headaches. So anyone who
Morning headache.
has a headache when they first wake up in the morning, which then gets better, like just when they're up and about. The reason that happens is your oxygen is being cut off to your brain because of
Mm.
those pauses in breathing you're having at night. And so that's what causes the morning headache. But then as soon as you're up and breathing normally, the headache goes away. So I noticed that when I actually got treatment with a CPAP machine, I noticed, oh wow, I don't have a headache, right? So I
Yeah.
wasn't necessarily telling the doctor, oh, I'm having a headache every morning because I just thought it was normal at that point.
Hmm.
But once I treated my sleep apnea, I realized, oh wow, I don't have a headache every morning. So that's one thing to look for. I'm trying to think of other things during the day. Some of the other things are high blood pressure that is really
Mm.
hard to get under control. Oftentimes, I'll speak to people where they'll say, "Oh, it was really hard to get this diagnosis with sleep apnea because the only things happening were high blood pressure and maybe a headache, but they didn't have some of the other symptoms." So
Yeah.
high blood pressure that doctors can't really get under control, sleep apnea can definitely be a factor in that. So it's worth talking to your doctor about.
Yeah, definitely. And can kids get this as well, the sleep apnea?
They sure
They,
can.
they can.
So kids with sleep apnea are going undiagnosed way too often. I mean,
Yeah, because I would
like
think so.
yeah. So the general population in adults, right? We think that around 80 million adults in the US has obstructive sleep apnea. And they reckon that about 80% of them are undiagnosed, which is such a
Mm,
huge amount. And in women, that's more like 90%. So loads of people are going undiagnosed all the time. So for kids, I don't actually know the stats for children, but I know that the amount of kids going misdiagnosed with ADHD when they actually have sleep apnea is a lot of kids. So the way that that works, it shows up differently in children. So
yeah.
you're going to notice, so in a sleeping child, They should be not moving around that much. They should be sleeping, like breathing through their nose with their mouth
Mm-hmm.
closed and silently. So if you notice your child snoring, that's not normal.
No.
If you notice your child even just being noisy, maybe they're really sweaty when they're sleeping,
Mm-hmm.
those are good ideas to kind of check with your doctor about potentially like sleep testing. Another thing is if kids have been dry at night for a long time and then they regress and they start wetting the bed again, that can
Mm-hmm.
be a sign of sleep apnea as well. So for kids, usually one of the first things they'll do is consider taking out tonsils to make more room.
Oh.
And then after that, they'll retest and then they'll see, sometimes kids do end up with a CPAP machine and the I know a lot of parents that don't love the idea of that, but them getting oxygen to their brain and getting that deep restorative sleep is so vital for children. It's when so much of their, growing happens and just their brains being able to like, have a proper rest at night is really important. So from teachers' point of view, the way that oftentimes sleep apnea particularly will show up is in the kind of behavior that you would think would be ADHD. So a lot
Mm-hmm.
of adults will show up with sleep apnea and have daytime sleepiness, and that can still happen with kids, and especially for other sleep disorders like narcolepsy, idiopathic hypersomnia, and other things.
Mm-hmm.
You'll see a really sleepy child. But for sleep apnea, oftentimes what happens is it's almost like they're fighting being sleepy. So it comes out as a sort of hyperactivity behavior. So for children, it's very difficult. Like I really empathize with parents because
Yeah.
a lot of pediatricians, not to mention, primary care providers and GPs, they don't receive enough training on sleep and sleep disorders.
Yeah.
So really the very best thing you can do is get a referral to a pediatric sleep specialist. So they're going to be board certified in sleep and ideally someone who specializes in pediatrics. So if you're in a larger city, like that's going to be much more doable than people in more rural settings. So
Yeah.
again, it's that equity part of it of not having quite enough specialists for to go around.
So, you talked about it, and I think this is probably some of the problem with sleep apnea, is that people are in denial,
Yeah,
because the I guess kind of like the stigma around it. I think people associate it more with someone who's older, maybe in their
yeah.
60s, 70s, 80s, or whatever. And a lot of people don't like the solution with it,
Hmm.
which is that machine. If that's what they're doing still, I don't know. But give me your take on that. What are some of the new things that are out there to treat sleep apnea? What are some of the what would you say to the person who's like, yeah, I'm not doing this because I'm not trying to have that in my bedroom,
Hmm.
sleeping next to my husband.
Yeah,
All of the things that we think about when you go in and you got to make this decision. Am I going to deal with this or I'm going to just act like it doesn't exist?
right. That is so common. That's
Yeah.
exactly what I work every day on trying to shift attitudes around, right?
Yeah.
So at Project Sleep, we have an awareness campaign called Sleep Apnea, Let's Face It.
Hmm.
And a lot of what that's around is shifting some of these stereotypes that it's only older, overweight men that have sleep
Yeah.
apnea. So I remember soon after I got this diagnosis, I was at a cookout in my neighborhood. And it was like a kid's birthday party, and one of the dads was kind of like, "Hey, how's it going? Haven't seen you for a while." And I said, like, "Oh, I'm good." He was like, "What's new?" And I just happened to mention, "Oh, I just got diagnosed with sleep apnea, and now I've got this, CPAP machine that I'm sleeping with."
Yeah.
And he just looked really shocked, and he said, "Oh, I thought that was something that big old truckers had." right? So it definitely like reinforces like stigma, shame kind of
Yes.
feeling of like this is not something that young women
Yeah.
have, right?
Mhm.
So I think a lot of the times we're trying to combat that. So about what you said about treatment. So one of the things that's great is we're coming into a new phase where we're getting a lot more treatment options.
Mhm.
So it used to be that the only thing was CPAP. And so for people that aren't familiar, that's continuous positive airway pressure. So
Mhm.
it's a machine that most people have seen now. Like I feel like it's on the TV and, people know.
Mhm.
But there's a mask where it blows pressurized air into your airway that holds it open and stops it from collapsing, right?
Yeah.
So that is oftentimes where doctors start because it's so effective when people use it. But
Mhm.
the issue is, like you were saying, a lot of people don't want to use that, or it just doesn't fit with, their idea of what they want to do.
Yeah.
So there are multiple treatment options. So one of the other things is there's a special oral appliance that you can go to a dental sleep medicine dentist to get fitted.
Oh,
So
wow.
that will hold your lower jaw slightly forward so that it doesn't collapse back into your airway. So that's a good option for certain people, usually milder sleep apnea, but like can be super effective.
Mhm.
And again, like, you can't see anything from the outside, so people tend to prefer, like that part of it to CPAP.
Mhm.
There's also, it's so individual, right? Like not every treatment option is going to work for every person. So there's also surgery. So we talked about removing tonsils. So if there are adults who have really big tonsils and haven't had them removed, oftentimes they might see an ear, nose, and throat surgeon and have the tonsils removed, and that
Yeah.
can really help people. There's other surgical procedures. You might have heard of the Inspire implant. So
Mm.
that is what's called, it's a very big mouthful, but it's a hypoglossal nerve stimulator implant. So what
Mhm.
that does is it stimulates the nerve in your tongue to move the tongue clear of your airway as you breathe in. So
Mhm.
if you imagine we talked about that your airway becomes blocked and sometimes the issue is your tongue blocking your upper airway. So for
Mhm.
people where that's their issue, the Inspire implant, or there's another one called Genio, which is kind of similar. And those can help some of those people. And again, like when it works well, it works great for people.
Yeah.
Um,
Yeah.
there's a bunch of other surgery. There's also like more invasive surgeries for some people. Having double jaw surgery is
Mm.
an option. The other thing is we talked a little bit about how sometimes people in bigger bodies have higher risk for sleep apnea. So last year, last December, one of the GLP-1 drugs, Zepbound, got FDA approval for treating obstructive sleep apnea in people that have obstructive
Really?
sleep apnea and obesity together. So it's not for every person with obstructive sleep apnea, but for people who
Yeah.
where obesity is part of it, it can be helpful.
Yeah.
So and also there's combinations of different treatment options. There's also something called positional therapy, where your doctor will be able to explain about like when you did your sleep study, some people only have sleep apnea when they're lying on their back. And so for those people, being positioned onto their side and at an angle can be all
Mhm.
they need to treat their sleep apnea.
Treat it.
But what I want
Wow.
people listening to take away is you must go and get tested. That's the
Yeah.
only way to know.
Yeah.
It's much easier than it ever has been. You can often do it with a device at home in your own bed. But until you get tested, you don't know how severe your sleep apnea is, and you don't know, like what's at stake, really.
Yeah.
So even people that hate the idea of CPAP, I've talked to a number of people, and it's not going to be right for everybody, but I've talked to a number of people who have done an in-lab sleep study and had a CPAP put on them in the middle of the night, and then they woke up and just felt so much better that they just
Yeah.
were like, I didn't like the idea of this, but like having oxygen in your brain is
Yeah.
really important. And
That is
like,
true.
yeah, so.
Well, you know what? It's been a great conversation. I got a lot of notes here for me. I'm just saying. think
And
I'm gonna
also you
start?
have my details now. You can just ask me
Yes.
questions anytime.
Think
We
I'm gonna
should,
start with making an appointment, okay?
yeah. So we should just mention really quick. So
Mhm.
Project Sleep have a free national sleep helpline.
Oh,
So where anyone can call, and of course I don't have the number.
I
So
will find it and post
yeah,
it.
project-sleep.com is the website, and people can go there and you can either call or you can send them a message on the website or an email, and they'll get back to you with helpful advice. And so essentially what it's not medical advice, but it's what people really need to navigate to the right place
Yeah.
to figure out their issues. So they do like a screener so you can kind of see, do you have some of the signs of some of the more common sleep disorders and who would you go
Mhm.
and see about that? So that's
Yeah.
always a great place to start if people just are having issues or questions about their sleep and they want to talk to somebody.
This is great. You know what? I just want to thank you, not only for your expertise, but you know what? You're passionate about this, and I can tell through our conversation. And I think it's something very important, that will help a lot of people, to get better sleep. And that's
Yeah,
what we need as teachers for
it
sure.
is. And thank you again to all the teachers, like
Yes,
on
yes.
behalf of all the parents. Like
Yeah.
we really appreciate everything you do.
Yes. So, Emma, what's next for you?
Well, I am coming up on in April, it'll be a year since I started my awareness campaign, Sleep Apnea, Let's
Oh,
Face It. So I'm working on doing a bunch of, articles and media around that, trying to connect with influencers and yeah, and just more like I still have my Instagram accounts. I'm always there and people can always find me at Sleep Apnea Stories. And
mm-hmm.
I'm just busy working away at Project Sleep. We're doing a bunch of work right now on Capitol Hill to try and get some changes
Wow.
to some of the policies they have, which I think are really like it's way too complicated to explain. So Medicare and
Yeah.
Medicaid have some really limiting diagnostic criteria, which are missing
Gotcha.
out too many people, especially women. So we're trying to change
Hmm.
that.
You're
So
trying to
yeah,
change
I'm
that.
keeping out of trouble
You're
and staying
busy.
busy.
You are busy, and I love it. You know what? You're going to change lives, my dear, and I love that.
Well, thank you for having me.
Yes. So thank you for being on the show. You reminded us today that sleep is not just something our bodies do. It is something our hearts and mind and nervous system need in order to survive and thrive. So, from the bottom of my heart, thank you for standing with educators, for shining a light on sleep health, and for giving teachers permission to listen to what their bodies are trying to say. And to every teacher listening, if you've been waking up at 3 a.m. with your thoughts racing, your chest tight, your heart heavy, please hear this right here. Nothing is wrong with you. Your body is not betraying you, it is speaking to you. It is asking for space, it is asking for gentleness, it is asking for rest that reaches deeper than just sleep. Teaching is sacred work, but you are sacred too. Your nervous system deserves peace, your heart deserves quiet, and your mind deserves to feel safe again. So, tonight, when you lay your head down, let the world wait. Tomorrow will come when it comes. For now, choose to breathe, choose to soften, choose yourself. And until next time, this is Franchesca Thompson reminding you you do not have to carry the weight of the classroom in the dark of the night. Keep thriving and get some rest.